Toby Keith recently died of gastric or stomach cancer, and a lot of you have asked, what can we do to prevent that from happening to us? While gastric cancer is the third leading cause of cancer deaths in the world, it is much less so in the United States, partly because of our diet, ironically enough. But gastric cancer is a silent killer because the symptoms of gastric cancer are typically a little bit of nausea, a little bit of discomfort, a little bit of bloating, pretty common symptoms for a lot of people to have. And gastric cancer is best detected early because if it's detected early, we can surgically remove it. Risk factors for gastric cancer are two big ones: smoking and drinking. Those are the two big risk factors we have. A third big risk factor is Helicobacter pylori infection. That's a bacteria that infects the stomach, which can lead to both stomach ulcers and a higher incidence of stomach cancer. It's pretty easy to eradicate with antibiotics and something called proton pump inhibitors, but you have to remember, whoever you kiss needs to be tested and treated for H. pylori, Helicobacter pylori infection also. There are some rare causes of gastric cancer. There are certain people who have genetic predispositions. If you have family members who have gastric cancer, please see a medical geneticist and have yourself tested. And finally, there are dietary things that lead to an increased risk of gastric cancer. There's a high incidence of gastric cancer in Japan, predominantly because of a very high salt diet and smoked fish. Both of those are really, really hard on the stomach. Japan has done a lot to do early intervention. Almost every mall you go to in Japan has a place where you can go in and have an endoscopy to look inside your stomach. They have been leaders in the world in trying to decrease their incidence of stomach cancer, and they've been fairly successful. So if you're concerned about those sort of vague feelings, please see a gastroenterologist. You can modify your own risk factors, stop smoking, decrease or stop drinking, get in better shape. Obesity is also a cause. It affects men over women by about 3 to 1, but there's a disturbing finding of more stomach cancer seen in younger women and is exceedingly aggressive. So all the modified things that you can do are all things that can help you. The best diet to decrease the risk of cancer is one that is high in fruits, high in vegetables, less high in meat. That would also be the Mediterranean diet. Like, follow, share.